Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everybody. Welcome to The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon in Atlanta, Georgia. You can learn more about me and get connected at www.drshanibelgrave.com. I am delighted to welcome to the show today Dr. Whitney Lankford. Dr. Lankford is an obstetrician and gynecologist at Greater Atlanta Women's Healthcare. She's here today to tell us what we should know about PCOS, also known as Polycystic Ovary Syndrome, a condition that affects so many. Dr. Whitney Lankford, thank you so much for joining the coalition.
Thank you for having me. Very excited to be here.
Outstanding. So I know that this is going to be a very impactful episode, but there's something I need to let our viewers know, Dr. Lankford. You are from Maryland. I grew up in Silver Spring, Maryland. So I wanted to give a shout out to the DMV area code 301. You already know what it is.
Of course.
So, Dr. Lankford, now that the viewers know that you are from Maryland, what else can you tell us about who you are and what you do?
Well, as you've stated, my name is Whitney Lankford, a native of Fort Washington, Maryland, not too far. I went to school at Clark Atlanta University, which brought me down here to Atlanta quite some time ago, but I won't age myself. And after I finished my undergrad degree, I briefly left Atlanta after I taught elementary school, but then came back. My heart must be here to Morehouse School of Medicine, where I did medical school and residency training. And now I am employed at Greater Atlanta Women's Healthcare. It's a great office, so come see us if you'd like. But we offer a wide range of care to women of all ages at any stage in their life.
Outstanding. So, as a bariatric surgeon, I see many patients that have PCOS. 50% of patients with PCOS have obesity. So, there is that overlap. So, I'm super excited that you're here to share your expertise. What can you tell us about the magnitude of PCOS, how common it is?
So, the actual incidence is about 7%. 7% of women will experience PCOS. And when we talk about PCOS, we're talking about the broad umbrella of anovulation, or women who aren't ovulating regularly, amenorrhea, where they don't have periods at all. And then there's a myriad of other symptoms. So the ovaries look different on ultrasound, so polycystic, larger in size. And women may then develop symptoms of hirsutism or excessive hair, and hyperandrogenism. More rarely, you see temporal balding. You may also see acne, and you may also see deepening of voice in a very small subset of patients.
So, how is this condition diagnosed? For someone watching who has any of these symptoms, how is the diagnosis confirmed?
So first, I want to clarify that there is no universal screening for this condition. So this is not something that when you go to your appointments that you should necessarily expect to have lab work or ultrasound workup done for, unless you express some of those symptoms that I just described. But if you were to experience those symptoms, we will start with a pelvic ultrasound. And in that, we're looking for ovaries that are large in size, have multiple cysts on them. And there's a specific number. It's about more than 12 cysts on each ovary. And also, we were going to do lab work. So we need to know if your hormone levels are elevated, as well as metabolic syndrome labs to test to see that you aren't pre-diabetic or diabetic range, that your lipids are okay, and things of that nature.
Mm-hmm. Mm-hmm. And then what would you say are some of the options in terms of treatments?
So the treatments are multifaceted. So we're basically treating symptoms because there is not necessarily a cure. So for women who are experiencing more hirsutism or more of the excessive hair growth, they may go for a different tree of treatments. But for all women with PCOS, we're going to start with oral contraception or hormonal therapy. So we can start with birth control pills. Now, some women may shrug their shoulders at birth control pills because it's not all of our favorites. However, it is used to control the symptoms, because if we understand what's happening in the body and that our ovaries are overproducing those hormones that are then aromatized or turned into testosterone in our fat cells, okay, and stored there. And we need the exogenous or outside hormones to help us decrease those levels. So we start there with hormonal therapy, and it doesn't necessarily have to be pills. Okay, it could be the IUD, the next one. There are various hormonal birth control methods that are available that can help to solve the symptoms. The other symptoms of hirsutism aren't the other treatments aren't necessarily birth control or hormonal in that nature, but they include creams and laser therapy and different types to suit whatever lifestyle each woman wants to fix.
Mm-hmm, mm-hmm. And what about the role of metformin as a treatment option?
Hot topic. So, what the studies have shown is that women with PCOS will have a 2 to 5 fold increase in their risk for developing diabetes in the future. So, when we notice insulin resistance on your lab work, we can recommend metformin oral therapy to help decrease those numbers and decrease your risk. So for a lot of women, where we notice that early on in the beginning, where they actually haven't manifested diabetes, because a lot will say, well, why am I taking metformin if I don't actually have diabetes? But it's a preventative method. And we will prescribe that to them at low doses to help with that insulin resistance. And we know that insulin resistance can manifest in different ways. And it's very beneficial in our patient populations.
Absolutely. Do you have any thoughts on lifestyle changes or dietary changes that can be effective as treatment options?
Absolutely. Because we know that one of the main symptoms of PCOS is anovulation, or the ability to ovulate regularly and monthly. We know that even a 10% weight loss can help with that. So when we talk to women, our first step in lifestyle modifications is regular exercise, at least trying to get 30 minutes a day for 5 days a week at baseline, and things that get your heart rate up. But then we also talk to them about their actual diet. Um, Specifically in our office, we have a dietitian, but we want to get a better sense of what it is that you're eating, your portion size, when are you eating, make sure that we're all on the same page about what our goals are and what exactly we're trying to do. And we can help monitor your weight in the office with regular follow-up visits along with your lab work.
I see. So, in terms of other signs or symptoms of PCOS, are there other things that go along with PCOS that are maybe less talked about or less known? For example, mood disorders and things like that.
Yes, there are a few. What people normally gravitate to, those big symptoms that I just talked about, so the excessive hair or things like that, but the deepening of the voice, the acne, the color changes of the skin is a big one. For a lot of my patients, they miss that. Different seasons, we're different tans, we're outside, we're in the sun, but that is another big clue that can help you see what's going on. These symptoms also can be confusing for other endocrine issues. So when we talk about what else could it be outside of PCOS, it also could be issues with the adrenal gland and things like that, or tumors that secrete these hormones. So we want to look out for those things. There may be mood changes, because we know that testosterone is linked to a little bit of aggression or moodiness. Sorry to our men, but yes. So you may notice slight changes in the mood, although less common.
Mm-hmm. Mm-hmm. Okay, well, thank you so much. That's really good information. What would you say to people about PCOS that they may not have ever thought about or ever been aware of?
The first thing that I want people to know is that you are not alone in these symptoms. A lot of times I see patients and they say, this is happening, and I'm not really aware of anyone around me who has had these symptoms, or I know someone that knows someone that knows someone that may have had these. I want to empower women in general to share your stories with each other. These are how we find out new information. This is how, we learn about things that otherwise wasn't taught to us. So if you are experiencing anything in your body that's a little bit abnormal, I want to empower you to talk first to your friends and family, but then to a provider of your choice. Um, it does not matter the severity. So if you say, oh, it's just slightly a little bit of new hair growth, it's just a little bit of a change. We want to look when you start to notice it. Don't let it get to a point where there's some pretty drastic or markedly high changes. Also with PCOS, I want to dispel the myth that you cannot have children.
Mm.
A lot of women have done their own personal research, and the studies do show that there may be difficulty with fertility, but with the medications and treatments that we've now developed and the information that we've now gained about the condition, a lot of women are having successful pregnancies despite the diagnosis. And we want to inspire you and give you hope that if a family is something that you aspire to, it is something that is within your reach.
Wow, that's really empowering message there. I must say I have seen a fair number of patients who come in for weight loss surgery largely because of fertility issues.
Mhm.
And many women have noticed success, as you were saying, with childbearing after some weight loss. So that's good to keep people encouraged and motivated and inspired. Another thing I was just thinking about is in terms of some of the symptoms and so forth, is there a particular time when this becomes noticeable? Meaning, is there a certain window or age where if you're going to get PCOS, you have it?
So that window hasn't been pinpointed. Um, Women can experience it at any time after they've begun their menstrual cycles. It can present a lot of times it becomes more noticeable when women are trying to become pregnant, right? Because there is
Mhm.
an end result that is not occurring, and you start to wonder if these little symptoms are adding to what's going on. But for some women, it starts when their cycles are skipping months. So that is a big clue. If you're not having a cycle every month, or you go 2 months and then you have a heavy cycle and then you go 4 months, it's very unpredictable. That is out of the scope of normal. So those are the things we want you to realize. And it is a lifelong condition. So that's another thing I want to reiterate. Although you don't have to be on hormonal therapy necessarily your entire menstrual lifespan, um, it is something that you will have to deal with symptom wise. So however that manifests within you is something that we have to monitor for to make sure that it's not worsening or causing other symptoms, like we talked about metabolic syndrome.
Mhm. Mhm. So this episode was specific to PCOS. So thank you so much. But I was wondering if you could also just tell the viewers a little bit about what other conditions you treat and kind of what other areas are of interest to you.
Right. So, in that same vein of PCOS or anovulation or abnormal cycles, I see a lot of women who have abnormal uterine bleeding, and that can be caused by a large facet of things, but for a huge subset of the population, it is uterine fibroids.
Mm.
So we do a lot of fibroid treatment, medical and surgical. Surgical is not the end all be all. but it is a viable option for some women who experience large amounts of bleeding every month, or they have bulk symptoms and pelvic pain, or they're trying to get pregnant. So that's a big thing that we treat. And if not fibroids that's causing that, there could be other uterine causes like benign polyps, which is just small growths within the uterus of extra tissue that you want to get removed, or various other things. Of course, we do a lot of contraception management and family planning because everyone has their choice of when they decide to pursue a family, or if that's not in the cards for them, which is perfectly fine. But it's a very big thing that we want women to feel empowered to see a provider about. The biggest thing I will tell you is just wellness care. Just having your yearly visit. I tell my patients all the time, I just love to see you. I want to see you next year so you can tell me about all your vacations and what's been going on. But besides us just talking, just knowing that things have been going well, not only with your physical health, but your mental health, how things been going in your life, any new stressors or anything of that sort. And like I said, we offer care in multiple things. Of course, we offer pregnancy care, which is a big chunk of what I do. I do love delivering babies just as much as I love being in the operating room and seeing patients in the office. So there's a fit for all women in all courses of their life.
Well, that is wonderful. I was looking at the fact that you are involved with your sorority, that you are passionate about improving maternal outcomes in the state of Georgia, and that you're very interested in education and community advocacy. So I think that you are the perfect fit for the coalition because that's what the show is all about. How can we improve health and transform lives? Dr. Whitney Lankford, thank you so much for joining the coalition. Is there anything else you want us to know?
I want to say thank you again for inviting me. This is a great opportunity. I love to speak on these topics. So, should you have any other ones that come up or your viewers have anything that's pressing, I would love to come back and speak with them about it. And I just want to reiterate that I want everybody to feel empowered about their health, feel like they have a say in what's going on. Find a provider that is the best fit for you so we can do some shared decision making about our healthiest future so we can do the best for ourselves and our families.
Dr. Lankford, for people watching the show that want to connect with you, what is the best way for them to reach out to you?
So absolutely. So the easiest way to get to me directly, I will tell you, is through my Instagram. And that is Witness MD, a slight play on words. So Wits, WHITNESSMD. You can reach out to me there and feel free to send me a DM. Now, give me some grace because I may not respond immediately, but I'll see it. Um, and then if you want to reach out to me about office matters, you can visit the office's webpage. And it's Greater Atlanta Women's Healthcare, but we use the acronym GAWHC, so www.gawhc.com.
Phenomenal. Well, thank you so much, Dr. Whitney Lankford. I'm glad that you have volunteered to come back. So we'll just have another time for you to share some more information about a different area of your expertise.
Absolutely.
For our viewers, thank you so much for watching. All right. Thanks, everybody, for tuning in for another impactful episode of The Coalition. Thanks so much for joining. Thank you so much to Dr. Whitney Lankford, obstetrician and gynecologist at Greater Atlanta Women's Healthcare. You can connect with me at www.drshanibelgrave.com. You can connect with Dr. Lankford at Witness, WHITNESSMD on Instagram. I'll see y'all next time.